joined now by some of those workers who are once again on the front line fighting coronavirus. Simon Walls is the clinical lead nurse at St Cecilia's nursing home in Scarborough and thinks the biggest problem actually with the second wave is going to be complacency, which is interesting. We also have Professor Helen Stokes-Lampard, GP and chair of the Academy of Medical Royal Colleges, and believes we're far better equipped than we were before, which is good news. And Tom Best, Dr Tom Best, is a clinical director of critical care at King's College Hospital, who also thinks, quite encouragingly, that we can manage a second wave. Good morning to all three of you, and thank you for everything that you're all doing. Let's turn to you, Simon, first, because, of course, care homes were, you know, the massive scandal, of course, about people with coronavirus being sent back into care homes and then it being a total disaster. Tell us what you feel now about what's coming.
Well, obviously, we've got a lot of trepidation about what's to come after being through what we've been through in the first wave. I know, Kate, that our thoughts are with you and your husband all through this time, and you know how difficult it's been. This time round, hopefully, we're a bit better prepared. Certainly, we know a little bit more with regards to infection control, but the first time round was extremely difficult for all of us.
And do you feel that you have more support from the government in terms of guidance, in terms of structure? Of course, PPE, we're hoping, is fully there for all of you now. Or are you still feeling as though that you are slightly left out in the cold?
I think it's getting a little bit better, although PPE is still a little bit hit and miss with regards to what we get from the government. Thankfully, our directors have managed to source other supplies, but obviously the prices have gone up on those, and that has a toll also on the business as such. With regards to everything else, we talked about mental health being a big issue with both staff and with our residents. We're not having any visitors and things like that, so it is difficult, but we're hopefully we're going to be fine this time.
Simon, I'm sure it is difficult, and thank you for your thoughts for me and my family as well. It's very kind of you, but it is very tough, and it's been going on for a long time. Let's speak to Professor Helen Stokes-Lampard, GP, and also chair of the Academy of Medical Royal Colleges. You know, you see, as a GP, the impact of this pandemic, not just in those contracting the virus, but on other illnesses and diseases, and the impact on having the opportunity to treat those. Do you feel more prepared, more across it this time? Or do you think the fact that we're going into a second wave after so many months actually is straining the system even further?
Well, if I speak for the whole system, because that's what the Academy represents, then actually the system is better prepared in terms of the practical things. So yes, we've got the PPE, we've got the ventilators, we've got the Nightingales as our emergency backup if we need them. Pleased that we don't. But actually, we do know a lot more about the disease, so we know better how to treat it. But that doesn't take away from the fact that we've got an NHS workforce that is tired and stressed, and we've mentioned the mental health toll that this disease has taken, but also under huge pressure still to start clearing the backlog left from the spring. And the big plea that I would put out is we need to keep this virus under control, because if we don't, it is completely distracting the NHS from doing all the other things that it vitally needs to do. And I'm not just talking about the cancer care and the heart attack care, which of course we've kept doing throughout the pandemic, but all the other stuff, the chronic disease management, the people with diabetes who need looking after, the rheumatoid arthritis, the patients with severe mental health problems that need our help. And all these things are unfortunately get pushed slightly down the priority list when we have wards and wards full of acutely very unwell people and from general practice.
And do you think that this time around that we can get the message, and is it the right message, of course, from your point of view, to say that you should use the NHS, it is there for you, even if you don't have coronavirus? Because, of course, that's been the big problem the first time around, that stay at home was taken so literally that, you know, we now know that many excess deaths were not related to Covid-19, but were in fact to do with people too afraid to go into these clinical settings for the fear of contracting it. Can we give them more hope this time to say the NHS is open?
Yes, we can. And it is such a delicate balancing act. You're so right. And this is something we've struggled with and the public have struggled with, and certainly the politicians have struggled with. But essentially, the NHS has bolstered its capacity wherever it can. We haven't been able to magic up lots more healthcare professionals, of course, but we've done just about everything else that we can. We've changed the ways we work, and people are really struggling with the fact that they don't seem to think that a telephone conversation or a video consultation with a doctor is the same as face-to-face. And of course, in some ways, it's not quite the same, but it does give us the vast majority of what we need. So there's the adaptation process. But we do need the message out there that if you are unwell, it's much better to come forward and seek help now than when things get very serious. Just yesterday in my practice, I almost found myself arguing with a desperately sick patient who I really needed to go into hospital. The hospital were ready to accept her. The ambulance was lined up, but she was terrified that she would pick up coronavirus and die of that. And so, we're all playing this very delicate balance. So we're trying to reassure people that the NHS is as safe as it can possibly be given these crazy times. And we desperately care and want to look after you and do our best for you. But once the virus spirals out of control, as it is doing in some parts of the country, we have to suspend all the extra stuff we want to do and focus only on the urgent. And that is not a good thing. It's not good for mental health. It's not good for physical health. And it has long-term impact on the economy as well. So this is complex, but the fundamental rules are the same. Hands, face, space is something we can all and must all be doing, irrespective of what tier of the country we're in. And if we're asked to isolate, please do so properly.
Now, Dr. Tom Best, Clinical Director of Critical Care at King's College Hospital, very positively thinks that we can manage a second wave. It's good to hear that. Now, look, when Derek was taken, my husband was taken into critical care first. It was on one of those very first weekends where literally those who did your role at the hospital he was at said it's like the Somme. We are patching up. We are trying to stop people dying. We don't know what this disease can do. And there has been more learned. At that point, everybody thought it was just about the lungs. They didn't know all the other implications of the disease. However, for you, you're still facing many unknowns, aren't you? In the sense that we don't know the impact of long COVID. Some people may get reinfected. We may see people coming in presenting in slightly different ways, I understand, from critical care units. So what can you do to make sure that this second wave isn't as bad as the first wave?
Well, Kate, I'd like to just echo Simon's comments first, with regards to you and your family. And obviously you've had, more close personal experience than anyone should have, really, of what that was like. And, I think, we are better prepared now. Obviously, you can't build an intensive care unit in 6 months. They're very complicated places from a technical and environmental perspective. But what we've been doing over the last 6 months is, I guess, understanding what we dealt with better, understanding the condition better, and planning with all the resources we have. So we do have more space in our hospitals. We do have more equipment, and we've been working not only to build our own departments up in a short period of time, which is also very difficult because all the doctors and nurses that we require need a huge amount of training, but also working with colleagues in other specialties so that we have willing and able staff who can help us should that need arise. I think it is, it's very difficult to look forward and know exactly what to expect.
Are you freer, though, to, for instance, use some of the learnt pharmacy, I guess is the way to put it, that has helped, that has ameliorated symptoms? Donald Trump has talked about the steroids he's had, dexamethasone. Are you free now to use those in a way that, for the first wave, there wasn't knowledge and there wasn't the license to do so?
So, yeah, I think we're very lucky. There's been a huge amount of research that's going on. Some of it very, very rapid. And, ourselves at King's were involved in a lot of that research with the antiviral drugs, remdesivir, with steroids. And, these are all marginal gains. They're all part of the kind of portfolio of interventions that we apply in intensive care. And, we hope, they will have an impact. It's hard to say at this stage, but the point is we need to maintain quality. So to be able to control the flow of patients coming into our unit so that they can all get the best possible highest quality critical care, whether they're suffering from COVID pneumonia or, you know, some of the elective work that desperately needs doing, or other emergencies that we're seeing as well. So I think absolutely we're all going to benefit from the research that's being done, and we're certainly benefiting from access to the drugs that we need as well.